Okay.
Good.
So I
Good
will
evening.
introduce you, as we always do. Hi, everybody. Shalom lekulam. We are here with another meeting with Dr. Alexandra, representing Swiss Medica clinic, and we are very, very happy to have you again. How are you? Doctor, how are you?
Thank you. Everything is fine, and I'm very glad to hear everyone, to listen, to see familiar faces, and thank you for your interest for this topic. And I'm sure that you have a great deal of information about autism. Today, I will speak briefly about common thing, and then focus your attention on the mesenchymal stem cells therapy, what we do for a pretty much a long period of time, and what results we see. And as well, I will kindly ask one of the person who is present here to tell about personal experience, what things could be observed after the therapy, because the best case, the best confirmation of the efficacy of the treatment is a story, is a real story from parents. So let's start with basic things about autism. You know that at the moment it's considered to be that two main things can be risk factors for autism, and these two big groups are environmental conditions and some genetic predisposition. Of course, some other issues connected with age of parents, some other comorbidities among parents, as well prenatal, perinatal, postnatal factors, mitochondrial dysfunction, heavy metal toxicity. Great impact can be connected with the immune system, so dysfunctional issues with immune system, and of course things connected with genetics.
So, on this topic, this year I've been teaching a lot about autism, and I was also checking with parents about their pregnancy. And what I saw in the last year, and I think I saw over 200 patients, both in hospital and outside of hospital, is that I saw an increase of something very interesting, and that is infectious diseases or autoimmune diseases or diabetes in pregnancy. And I saw with these parents, when I asked the mothers, what was your medical history in pregnancy? I saw an increase of these numbers. So I can definitely agree that what happens during pregnancy or close by to pregnancy, before or after, definitely affects what happens to the child's brain. And it was really interesting to see. And even today, when I accept a new patient, I ask, how was your pregnancy? Did anything happen? Did you have pregnancy diabetes? Were you sick during pregnancy? And I can see with a lot of patients that they were, especially in the beginning and last part of pregnancy. And then you see the results, and it's very interesting to see. And I think that over the next few years, we will definitely continue monitoring these patients because there might be something that we can do.
Yeah, I completely agree with you that one of the main factors, and it is one of the big and strong theory of autism, is misbalance with the immune system. Yeah, and last trials showed that among autistic kids, the level of inflammatory markers are much higher, and after the treatment, for example, with the stem cells, because mostly we speak about this therapy, children after having the mesenchymal stem cells therapy, not only autistic children, but with other problems, had reducing of inflammatory markers. that also has a certain confirmation that autism is a kind of serious misbalance with immune system. And you, like people who have interest with the autism, you know for sure that main three things which can definitely describe as basic symptoms of autistic child, that these kids they have difficulties with interacting with other people or kids. They have poor eye contact, and they cannot express themselves. They have difficulty communications, and many of these kids, they have they are non-verbal, or they have problems like delay of speech, and in comparison with their peers, they have less vocabulary words, so much less, yeah, and they can be compared with kids who are 2-3 years younger than they. And very common thing for those kids who can pronounce sounds, can pronounce words, that they have a repetition of the words. When you ask them, how are you? Very often they say, how are you? How are you? Just like, you know, mechanic repetition without sense, yeah, without paying sense to this phrase. And of course, they have restricted, repetitive behavior, like doing something like their rituals quite often, or hand flapping, or things like this. Of course, these are three basic things. In reality, these kids can have as well some other issues. Very often we see in our clinic that the kids have severe constipation. So if we move clockwise, you see that like if the clock is on the 7 p.m., yeah, it goes severe constipation among kids, and sometimes seizure disorders. And many kids can have combination of abnormal EEG. Very often we ask them to share with us the data, and EEG is not like normal should be. These kids can have as well agitation or aggression, anxiety, hyperactivity, very, very often, yeah, that these kids, like without feeling tired, can be active 24 hours, even at night, and automatically problems with the sleeping, yeah, and for sure intellectual disability, language impairment, the genetics, which we mentioned as basic reason of autism, one of the basic reason, can have these combination of genes problems. They are in red colors, and that is why very often parents do genetic tests and can find one of these misbalance. And sometimes they find those changes which are not considered to be like those ones that can cause, that officially can cause this problem, I mean autism. And for sure it can be like, as we mentioned, immune problems connected also with mitochondrial abnormal functioning, and as well not normal level of serotonin, and not proper size of kids. So it can be macrocephalia or any other issues connected with the morphological size of brain. And when we after having a clinical description, manifestation, symptoms of autistic kids, you know that so far there are many approaches for the therapy of autism, or just there are many attempts to help such kids. And I found a very interesting list of different diets, medications that are used in order to change the child's behavior to minimize autistic symptoms. And many of them you are familiar with them. And here we can see even different supplements, different supplements, medications, and very common, probably you heard about it as well, glutathione as antioxidant can be used, and some amino acids, ketogenic diet, and vitamins, and so on and so forth. And probably we can add to this long list of things which are used all over the world. We can add mesenchymal stem cells therapy, which I will explain right now because of unique properties of the mesenchymal stem cells. In our clinic, we've been using this kind of therapy for more than 10 years. At the beginning of functioning, it was bone marrow derived cells that were done to patients as intravenous infusion. It was only one procedure. And when the clinic was developing then new methods, we also tried, and we followed examples of our colleagues from all over the world, and we started to use donor cells. So right now we do for autistic kids such a protocol of intravenous infusion of donor cells as a drip, it looks like. We do as well intramuscular injections into buttocks area, like 3 milliliters. That is equivalent about 30 million of the stem cells. And actively we combine this therapy with exosomes, which you can also see in this picture. So in the center, you see that unique mesenchymal stem cell which we are discussing, which we see can work. And if we look at the brain, we see that scientifically proved there are many effects of the mesenchymal stem cell for brain. First of all, that is important for autism, it's suppression of inflammation. So neuroinflammation as a final reason of changes of autistic child's behavior. This neuroinflammation is suppressed automatically with using both mesenchymal stem cells and exosomes, those little blue vesicles which are on the top and down the picture, which stem cells actually produce. So if I show you these parts, these cytoskeleton of the mesenchymal stem cell, these are tiny vesicles which are produced by the stem cells. So it's like part of membrane can form this circle, and then with blood flow they go to problematic areas where there's inflammation, or if we are speaking about adults, degenerative process, and try in a maximal way to fix this problem. And except the suppressing inflammation, we can also tell that the stem cells improves functional recovery. So it is connected with it is a trigger this kind of therapy, it's a trigger for formation of new neuronal pathways among kids, among adults after stroke or some other events when these connections are functioning not properly. So stem cells help to recover these problems, and it increases definitely proliferation, or we say differentiation. What does it mean, proliferation? It's a medical term that says each cell is developing from immature form to more mature into a final stage of differentiation. For example, it can be a neuron, it can be an epithelium or a muscle, and developing from immature form to final cells is called proliferation. So stem cells definitely intensifies this problem, this process. And among elderly people, stem cells have neuroprotection in terms of in terms of developing neurodegenerative process, which is important for adults. So this is the effect connected with the brain, but at the same time, with blood flow, stem cells go through all organs and tissues, including kidneys. Yeah, the same happens there. Main mechanism of the functioning of the stem cells, it also suppresses and reduces apoptosis, what is the name for the programmed death of each cell sooner or later. So this process is delayed, and as well minimize the area of necrosis, the dead tissue, and as well you see that with other organs, including liver, cardiovascular system, and plus lungs, which are filters, and stem cells definitely go through this organ and can improve situation with lungs. And here we can mention immune system, that very often kids who came to clinic and who had allergic predisposition and chances for, you know, different skin problems, skin rashes. After the therapy, parents say that, you see, and plus asthma. Yeah, parents say, well, the episodes with asthma reduced. I spoke to one father from Israel who had therapy last year, and he told that within the year, they are in August, they are coming again. He told that they used inhaler 1-2 times. That is not common for them at all. So the lungs situation was much better in comparison with before. The triggers for spasm, for manifestation of bronchitis, etc., these cases were reduced greatly, and with good results. The father is going to come once again. And
I can tell you that it was the same for our middle child. Nevo was born very premature, very bad lungs, had RSV, had other lung conditions. He was ventilated twice and was left with some lung damage. After first therapy, it was completely gone. It was gone. It never returned until today. But for skin conditions, I can tell you that all 3 boys have very bad sensitivity to mosquitoes. When it's around therapy, you can really see that it's reduced. But as I go further away from therapy, it comes back. So if they get stung, let's say 9 months after, then again, they have some problem. But in the few first months, nothing. I mean, it's such a relief, at least for that short time, that there's no swallowing, no nothing. It's amazing. So I see what you're talking about every day. It's quite amazing to see.
And especially when we hear this confirmation from parents. So not only the autistic symptoms can change, but additionally those comorbidities which parents could observe, including constipation, better functioning of intestine, by the way, and as well kids, let's say, who were quite picky with food, yeah, and their interests for other products, the interests were limited, but after the therapy, it can also change. As well, if we look into, let's say, go further into details of stem cells functioning, we should say that stem cells therapy, one of the mechanisms, helps to achieve, let's say, balance between exciting moments and inhibition of neurons, yeah, with the help of controlling secretion of neurotransmitters. Yeah, as well, if to speak briefly about first mechanism, and as well, it is a trigger for growing of new vessels in all problematic areas and zones. So with expressing growth factor, yeah, this therapy can help growing new vessels in problematic areas, and then better functioning of this or that organ. Plus, stem cells have antioxidant effect, yeah, with preventing activity of free radicals, and it suppresses neuroinflammation, which is one of the reasons of autistic symptoms. This is a short reminding of autism, of the risks factors, of different symptoms, and our brief therapy for autistic kids using mesenchymal cells. If you don't mind, I will ask now one mother who is here, and all of you knows well her. This is Shira, that as a bright story, one of the probably, you know, prominent, significant story with changes before treatment, after treatment. Shira can tell the story, especially with the first son, with the left, when the first therapy was done, and then the next, what changes you had. Thank you.
So I think you were there the first time Dolev had a meal in maybe 3 years. So in 2019, we came to Swiss Medica with our oldest child. We did not know that there will be a day that all 3 of our boys will be taken care in Swiss Medica. Back then, we only had one child diagnosed with autism, but he was very sick. He had autism and epilepsy, and we didn't know that he had also an intestine problem, but he did. When we came to Swiss Medica in March 2019 for the first time, he was in diapers. He was eating formula and only formula. He was nearly 6 years old. He had seizures every few minutes. He was a very, very sick child, but he had no communication skills, so we couldn't know how to help him. He was not speaking. He was not pointing. He was not clapping his hands. He was essentially a 1.5-year-old child in a nearly 6-year-old boy's body. The second day we were in Swiss Medica, he received his first treatment. He was one of the first children in the world, probably, given care for autism and epilepsy. We had no information. Nobody knew. Nobody was able to tell us what's going to happen. I think it took hours until he was able to eat food. just hours. I think his first meal was fried chicken. It's really funny. I think he had his first meal maybe in a year or two in Swiss Medica. He very fast after started improving. But we also noticed some things that happened. We noticed that he was very hyperactive. We noticed that he's more interested to investigate his environment. Very soon after, he started having first words, which turned into first sentences, and very slowly he started to recuperate. It took years, and he's still being treated every few months. It's very difficult. It's not easy, and he's never going to be regular, but he's doing much better. He's seizure-free since 2019 and medication-free for epilepsy since 2019. He's able to go to the toilet alone, shower on his own, make his own meals. He goes to a regular school, to a special needs class. He's doing really, really well. At the moment, he's also playing chess with his sister in the other room. He refuses to go to sleep at the moment. But we learned a lot throughout the way. We learned that different children look different. We learned that children can respond in many, many ways to this treatment. We learned that a lot of kids become very hyperactive, and sometimes hyperactivity means that they're running around, and sometimes it means that they are very aggressive in the few first weeks, or sometimes it takes more than a few weeks to find out that they have hyperactivity. We learned that some of them get very scared after treatment because they understand that the world is a little different, and it can also be a very scary experience. But we learned that children improve. Not all children, but a lot of them do. And we also learned that there's the one ingredient in this process that if it doesn't happen, even the child that has the best potential to improve will not improve, and that's parents' care. If parents don't know how to treat a child, they don't understand how to interact with the child is not going to advance. He's not going to get better. So if I can only give one advice to parents, is learn before treatment how to work with your children. This treatment can do a lot for you. It can biologically help. We cannot biologically influence a child without this treatment. But if you think that this treatment is going to work its magic without rehabilitation, it's not true. And I can see a lot of parents who don't understand this main point. And I think you will agree with me on that part. We see magic. We see a lot of magical cases where children start improving in the clinic even. But for children to really do well, parents need to work with them.
Yeah,
Good enough story today?
Yeah, thank you for your story. And I think that many parents will agree that even without stem cells therapy, even if the child is not autistic, for any person, even for an adult, to achieve some kind of new skills, we should train, we should repeat this or that thing many, many times until it becomes automatic. Not saying about autistic kids. So that is why for formation new skills, I think it's a longer and more complicated process for them, yeah, with all these mechanisms and problems, comorbidities, if there are found such things, to help the kids to have new skills with constant repetition. This can be done if we are going to develop this or that skill. And you're right that it's not like in mathematics with any kind of therapy. With that list, with supplements, with the stem cells, it's not the same result with each child. Each child is individual, and reaction for the therapy is individual. With communication with other clinics, we also see that worst scenario, let's say minimum results, 0 results. Yeah, best scenario, some other things, symptoms can be less so significant, prominent, and certain cognitive function can be, kids can be toilet trained, can have better behavior in the kindergarten or at school, better ability to learn information, to express themselves, to communicate with other kids. This is very important, yeah, with constant repetition to achieve all these skills.
I also think that this year we did a lot of work cooperating between clinics, even with Swiss Medica. And I think that we learned a lot this year. We learned about different supplements. We learned about different testings. And what I like with Swiss Medica is that they are willing to listen. The company is very interested to make a real difference. And I can see that you take a lot from other doctors and you include it in your protocol. And you're very interested as a clinic to listen to other people's lectures and to meet other doctors that maybe comes from an area that's not like yours. And I saw that over the last year or two, we really made a lot of difference. The different clinics that I work with are willing to cooperate with each other and to learn from each other. And I think the children benefit from it. And not many clinics are willing to do this. And I'm very happy when I find a clinic that is interested. So I think we did a lot this year, and I'm hoping that next year we'll manage to do even better. But I do believe in this clinic a lot. And personally, of course, I'm being cared for in Swiss Medical Clinic. I will probably always have a warm corner in my heart. So I'm very happy that we still work together, and this area is keeping on developing. If we think about Dolev's first treatment, it was not even half of what we do today. I think he received 2 million cells a kilo, 1 injection, that's all. And we made a long way. So it's really interesting to follow and see what happens.
Yeah, and with a cooperation with parents, and additionally great cooperation, it's very helpful to see the dynamics, what's going on with the family, that we try to follow 6 months, what final results we have. And it's important to see, to understand what is the next step. If we should proceed, or if for kids who are teenagers and, for example, they had the therapy at the age of 16, 17, no results, then when this age, after 10 years old, when the brain is so-called closed for this kind of therapy, when the neuroplasticity is reduced greatly, then probably there's no sense to repeat. When the child is young enough, under 10, and neuroplasticity is high, even American specialists strongly recommend to repeat the therapy, and at least to do it 2 times, because the second attempt with the therapy can be even more beneficial. And as well, I should mention the colleagues from Israel, Dr. Gesundheit, who is a very, professional and talented person who is interested in developing the mesenchymal stem cells in Israel, and who observes the kids who had done the therapy in the clinic. He observes his team observes these kids in Israel, visit them, evaluate these kids with special course with special tables, and we also have objective data what is going on with kids, and plus confirmation of efficacy of the therapy is the parameters, such inflammatory parameters before treatment and after the treatment, and it's a very promising way to have scientific proofs of this kind of therapy. It's not a cure. We are not speaking about the cure, but it's a chance to help the child to be a bit more flexible, to start socializing, and you know, to be better in society, to feel better, and to express themselves better.
Well,
And
you didn't
yeah.
think I will let you off the hook without questions. So I've prepared a list of questions, of course.
Good.
So I think throughout this entire year, the number one question that we had was about hyperactivity. So we discussed it a lot this year. I even gave 2 lectures this year about why kids become hyperactive about stem cells. So I'm going to ask you now, why are kids becoming hyperactive after stem cells?
Well, as you know, first results of the stem cells therapy, we expect after 6, 8 weeks, yeah, when the therapy is finished. When the family comes home, there are cases, not many, it's not like each second child, but it's a less percentage, roughly it's like 10%, and in literature it is described that some kids start to be a bit more active than they used to be, yeah, before the treatment. And many specialists, it's not scientifically proved, these switch in the behavior, this change, but such a conception exists. It's a kind of awakening brain, like first steps with regeneration, reprogramming that can last as usual. Not in all cases again, like 2 weeks, something like this, and then this hyperactivity should be reduced. So
some parents really experience, they describe it like regression. So when a parent comes to me and say, my child really regressed, and they're at this around this time of stem cells, I try to figure out if it's really regression or if it's just this hyperactivity that causes this child to look like they regressed. Because when a child is very hyperactive, it can sometimes feel like they're losing some of their skills because they're not focused enough. And I had a lot of cases of this year, which is okay, because when I see it, I think, oh, great, he's responding to therapy. It will get better in a little while. But when parents have this phenomenon happen, I think they're very scared. They're not being prepared enough to what it may look like. And I think maybe some of the parents are here today that they're even that are worried about this phenomenon. So if you have anything to say, maybe how can we help these children when they're experiencing this very active time in therapy? Is there something that you think can help, maybe a supplement or medicine that can help them calm down a little?
Well, it's a very good question, and you want me to have like, you know, unique solution, but
it doesn't have to be.
Yeah, to my mind, I think all things can be tried, and to find the key for each child, as a common thing that is well known, to have such supplement like magnesium as an option, and to see that if the child is relaxed or not, if there's a simultaneously problem with the sleeping issue at the same time, then using melatonin, yeah, the common dosage according to the age. I think so. If for example, there can be connection with hormonal changes, yeah, when it is a child whose age is 12, and there are also signs of a child to have, period of becoming an adolescent, etc., then these changes, this hyperactivity can be connected with hormonal changes, and just to be patient and to wait until this period passes. But if it is a very pathological one, I mean, this hyperactivity is very abnormal, then to ask for the help of a local doctor who observes a child to do something, and then probably to prescribe even medications like Respilept, yeah, risperidone. This is the same, something that will reduce this activity. Of course, it's not the best way for achieving the normal level of activity, but still, like, the last option, because then what to do?
Yes, I agree. We speak a lot about why coming to stem cells, so I think it's important for people to know when it's not allowed to do stem cells. Also, a very common question this year.
Well, yeah, we had such cases when, for example, the family came to the clinic, and some kind of infection, even COVID infection. Last 2 years, it was a disaster with this infection happened while traveling. Then we explained the family that now the main problem for the body is infection. And the first step, the infection should be suppressed, it should be under the control. And when this period passed, then this therapy can be done. I mean, to postpone it, to do it a bit later. And this is among kids, such situation. Sometimes when we learn medical history of parents and we see that the child EEG is abnormal, and that there are many triggers, and that the child is close to epileptic severe seizures, which is discussed with our neurologist, etc., then in some cases we simply refuse such families. Or if there are some other serious health problems, and then it can be like expert advisory board learns this or that case, and we make final decision if we can accept this child or not. Additionally, the question with weight of a child, it's not like absolute contraindication, but sometimes we tell that, okay, at the moment the weight of a child is too small, or some problems with vein, serious problems with veins, then we can do like focus on intramuscular injection and inhalation of exosomes via mask and nasal spray, and just refocusing from intravenous infusion for different methods, ways of administration. So these are probably main things that we should mention. As well, if the child is after 11, 12, we explain that chances for improvements in comparison with younger kids are lower. Some families decide not to do it, and I understand them, because from the very beginning they have less chances, yeah, but some are brave enough and do this therapy. And Of course, some changes not so prominent as with younger kids can be observed.
I have to tell you that we treated quite a few teenagers in this clinic for the past 3 years. And I think that altogether we have 10 or 15 teenagers, so children over the age of 11. And all of them had results, not the same as young children. But if I can just give an example about two children, one child, a girl, came after she received her period. And the mother said that for the first time in her life, this child can take care of her physical needs. She can change a pad, she can clean herself. For this child, it's a very big deal. It's a huge part of her health care. And she was not able to achieve it before. This child is more interactive with other people. She's not running away from company when people come to celebrate her birthday. She wants to be a part of the celebration. For this child, it's a huge change. It's a life-changing change. She was treated twice, and she's now 13, so it's been a year, and she's doing really well. So for this kind of child, she's never going to be regular, but she's able to say a few words now. She's able to take care of her body. That's very big. It's not a small change at all. I think that we should all let the notion of these children becoming regular, let it be, because for us, it's a matter of changing their life for the better. We had another boy who is maybe, who's now able to speak more. He's able to communicate his needs more. He was 12 when he came. He's coming again for a second treatment. We had a little girl who had very bad epilepsy, who's doing better now. She's nearly 13 now. She already had her period. She has autism and epilepsy. Her epilepsy became better. And that means that she's able to focus more. They're not small changes, but it's very important to understand, even for the younger children. We're not speaking about making autism go away. We're speaking about bettering your life, making it a little more manageable, a little better, and their general health better. If parents are here thinking that, oh, we'll give them some stem cells and they'll be regular children. No, not the way it works. But these little things, being able to take care of your body, they're big, they're huge, they're life-changing. It means this child has less urinary tract infections, she's less sick, she's cleaner, she smells better, she looks better, she holds her body better because she's no longer swimming in her own filth. So I disagree with you. Teenagers can do really well. It's a matter of what we expect. And if you have teenagers that think that this treatment is not worth taking the chance of, then I have a lot of examples why this is so important to not give up on teenagers. And I will ask you, because I was asked this week. So we speak a lot about children and teenagers, but we never speak about autistic adults. And I know that Joan Kurtzberg has tried caring for adults with autism. She never advertised about her results, and I don't think she ever will. But I think that for once we should speak about it. Do you think that adults with autism can benefit from this treatment?
Well,
I get asked once a week. That's why I'm asking you.
You see, the oldest person with autism who was in our clinic was 25 years old, and relatives observed that after the therapy, this man, he became let's say calmer, and so his behavior changed. And this was just the thing that they observed, in comparison with his behavior before and after. I think that even this change is also good, especially when the family tried many things, possible and impossible. And these symptoms that connected with behavior, like one of the main concern that it worth doing it. And if the family wants, and if they aware that chances are low, very low in comparison with the kids who are
4-year-old.
under 10, yeah, then for sure we will try. We will try, why not?
As a person who raises autistic children, I think that it's a big deal. If your child is calmer and more comfortable, it's a very big deal. People think that it's not, but it means that the parents can go to the toilet in peace. It means they can cook a meal in peace. It's a big deal. It's a very big deal. So I'm very happy for this family, and I'm happy to know because I think it's worthwhile mentioning. And if anybody has questions, I think that we will let you ask. And then I think that enough for tonight. We'll let you go. Anybody wants to ask something, you can take off your mic. You can open your microphones and ask.
So my son had treatment at Swiss Medica. We are just back on 10th of June. He's 7 years old. I see he's doing those things what he was doing at 2 years old. Like he used to go under the bed with all the beddings and blankets and be there for longer periods. So he had stopped that totally in between, but he has started doing all that again, which is pretty new for me. And his speech has slightly improved. He spontaneously says with sentences which he has never said before. So that's a good thing about it. The teacher has reported to me that his IQ is slightly increased as compared to what it was before. But I'm really quite fed up of his behaviors that he was doing at 2 years old, which he's repeating now. So he's screaming a lot. He's extremely hyperactive. It started about, I would say, 4 weeks back. So we came back from Swiss Medica on 10th of June. We are nearly 27 July now. So I really don't know how long this behavior would be there, because I want to plan the second treatment. I want to see what effects we have got, basically. So just want to know how long this hyperactivity would last, please.
Tell me, please, now you observe it for how long period of time?
So he's been doing this for 4 weeks now, I would say. Yeah. He's like, he used to play with saliva a lot. So he would put a saliva, he would make things out of clay, like a cup or a teapot, and he would fill it with saliva and then drink that saliva again. Okay. Or he would spit on the ground and then drink that saliva again inside. So he's, it didn't stop ever, I won't say it, but it has become a lot now. He's 7 years old, 7 years, 3 months. His screaming is same. When we were at Serbia, I noticed something. For a few days, he was extremely calm. He would not whisper. It was such a beautiful thing that I thought we are in some other world. Okay. But as soon as we came back home, those things have again started. That peace has gone away. Okay. That peace was there for just for a day or two there, which was so beautiful that he came very calmly and sat close to me. I've never seen that before, ever. Okay. So, I mean, we enjoyed that peace for a day. Okay. And it's gone away. He's doing all those things that he did at the 2 years of age. Yeah. But speech, you won't believe, like he was yesterday, I was sleeping and he was putting a pencil in the radiator, and I basically woke up and I said, what are you doing? He said, put the pencil. And this is a very great improvement. Put the pencil, 3 words. He has never done that before. Okay. So this morning, I basically asked him, go down and get the diaper, and he never came back up. So I came down and I said to him, what have I asked you to do? He said, diaper. So he was aware that I told him to get the diaper from down. So that awareness is there. Yeah. Which was never the thing before. Okay. So that awareness is there. But I am just wondering how long this hyperactivity is going to last. I mean, how long is he going to do those things that he was doing at 2 years of age? Because we as parents are exhausted, and we really he has extreme behavior issues.
I see.
Specifically verbal stimming, screaming. As soon as he opens his eyes, he starts screaming, and the screaming is killing us.
Can I ask you such things during this period of time? If you know that something changed in the family, in the at school, for example, where he goes, or just among friends, something that probably can be the reason for these changes.
He was always the same. He, after the stem cell at Swiss Medica, for a day in the hotel, he was calm. For a day or two, he was like a normal child there. Okay. But as soon as we came to UK after the treatment, everything is back to normal. Okay. So I really don't, nothing has changed. Everything is same.
To be honest, quite, because you're saying that his verbal abilities are better, that his understanding is better. So there are some positive effects.
Yes.
If you want me to give you my 2 pennies as a nurse,
yes, please.
Developmental nurse.
Yes.
I see a phenomenon with autistic children, and I've seen it a lot in the last 4 years.
Where
the child progresses. So he has positive effects. He starts speaking, his understanding becomes better. He also tries to go back to being a younger child. It's behavior. Okay? It's a behavior problem, not cognitive problem. And we see it a lot with children that have a new baby brother. For the first few weeks, they're wonderful. They love the new baby. And then they understand this baby is the new ruler of the house.
Yep.
And they want their bottle again and their diaper again and be a young child. I think there's a lot of this developmental issues that comes up. When child progresses, they also understand that something new is happening. And they try to seek comfort in things they used to do in the past and calm them down. I see it a lot when I follow up on children, because I follow up on children after a month, 2 months, 3 months, up to 6 months. A lot of parents are saying, oh, my child wants his teddy bear again. Oh, my child does a lot of steaming now. He's very nervous. But then again, they also see child does amazing things, speaks better, understands better. It may be, in my opinion, not a doctor, only a developmental nurse, that there's a connection. I'm not saying he's not hyperactive. No. I'm saying maybe he's looking for comfort. And what I always advise parents is to try and substitute the behavior with something else that can give him comfort. So let's say shouting, okay? Because this really hurts our ears. Okay, because we only treat something that is harmful to us or harmful to the child. So let's say the screaming is harmful for us. Child really enjoys it. Use a biter. Use maybe an instrument he can blow into. There are some instruments you can blow into and they make a sound. Sometimes you can buy those with mufflers in the end, so the sound isn't very high. Okay, they need a repetitive action to relax. They are now going through a huge change, okay? A very huge, significant change in their abilities. No wonder they are stressed. So I think what you are seeing is partly hyperactivity. You can take that away, but partly also your child is growing, and he's growing something that he normally would do over a year time, over 4 weeks time. That's not fair that we expect them not to be stressed. Try to do that. Try to substitute the behavior in something else that is okay with you. So if your child uses saliva, maybe let them use juice. Tell them, I don't want you to spit and use saliva, but here, have some juice. Okay, you can pour it into the pitcher and drink that, or you can use maybe a straw, activate their orbital muscles. See, I told you I need to write a class about this. This is exactly what we were speaking about before. But I think that what you are experiencing is hyperactivity, hands down, no doubt. But also your child is growing, and autistic kids are not stupid. Mm-hmm. They feel the stress of growing.
Yeah.
We should not ignore it. Try it. It may work. And you can always schedule a consultation with Dr. Alexandra, right?
Yeah.
And speak about it, let's say in a week or two, see if it works. And let me know. I'll be very happy to know.
Yeah, surely. Thank you.
But I'm very happy that you reached out, and I'm very happy that you asked, because it's a great example.
Yeah.
Yeah, to a bit refocus a child from one thing to a bit different thing. It's a very good example. Yeah, how we should try, yeah, different things. Try, and with the straw, it's I think, why not? It's a good chance. Probably he likes screaming and expressing the noise with different methods. And simply to show, but really, and can I ask you, your doctor in Belgrade, who was your doctor, the name?
She was a young girl. Sorry.
Aida. Dr.
Aida, yes.
Aida.
Yes. Yeah.
Okay. I think, can you just try these things that we've discussed? And if you don't mind, in 10-14 days, yeah, like in 2 weeks, just let us know when it's a good time for you to talk, and we will, together with Dr. Aida, will speak once again what's happened, what else we can do.
Yep, surely. Thank you. Thanks.
Thank you indeed for your feedback.
Anyone else? This is the good time for questions. Okay. Well, if nobody wants to ask, I think we will stop here. We will have you again and again for many, many times, and speak about many, many different issues. So thank you very much for coming. And everybody have a very good night.
Thank you.